The following segment is presented by Bremo Pharmacy.
And today we're going to talk about a very important vaccine because the Centers for Disease Control says that 41,000 cases of pertussis, also known as whooping cough, caused some 18 deaths, and a lot of those deaths were from infants. So here to tell us more about the vaccine and how you can protect yourself is Tana Kaefer. Thank you so much for coming.
Thank you.
Now tell us about the vaccine. It's called Tdap.
Right, it's called Tdap, and it protects against 3 diseases, but we're going to focus on pertussis this morning since that's what we're talking about. Pertussis is a respiratory illness that can lead to a very severe cough. The problem is in the early stages of the disease, it can mimic kind of like a common cold, so sneezing, coughing, runny nose, but after several weeks, that cough can become very severe and actually cause difficulty breathing when you're coughing, and so patients will make like a whooping sound, and that's where the term came from, whooping cough.
Now, why are infants more at risk of death than adults?
That's a very great question. So as adults, when we get pertussis, it's a burden, but it usually is not life-threatening. With infants, they have not completed their initial series of vaccinations. So pertussis is included in the normal vaccination schedule for infants, and when they're less than 12 months of age, they have not been fully vaccinated yet. So they are going to suffer the horrible consequences from getting pertussis because they're not fully immune at that time.
Okay, and now what can parents do? I understand pregnant mothers can protect themselves.
Absolutely. So because these infants can't protect themselves, we have to provide what we call a circle of protection for that infant. So basically anybody who's going to come into contact with the infant, that includes mom, dad, older siblings who may not be up to date on their vaccinations, grandparents, and other caregivers. Again, anybody who's going to come in close contact with these infants. And the new recommendations actually recommend that women get vaccinated during every pregnancy in hope that by vaccinating mom can pass on some immunity to the unborn child.
So that is a new recommendation that people should really be aware of, because if you think, well, I just got that 2 years ago, or I just got that with my first child, they really need to know you need to protect yourself over and over again.
Absolutely.
Okay, now tell us a little bit about how Bremo Pharmacy can help. What questions should people ask when they come in?
Okay, so we do Tdap vaccination at both of our locations, Bremo Pharmacy and Bremo Pharmacy at Henrico Doctors. Henrico Doctors location is very conveniently located in the Women's Pavilion. Lots of women come there, or right beside the Women's Pavilion. Lots of women come there to visit their physicians during prenatal care. A lot of family members may come with them. So if anybody is coming there, it's important to be able to protect that unborn child, so everybody needs to get vaccinated.
Yes, yes, and I'm thinking too, this is something that's covered with health insurance. People usually don't have to worry about high vaccination fees?
It depends on the insurance always, so certainly something that we would work out for you and try to figure out.
Okay, and I also want to know, people think of cold and flu season. This really doesn't have a season. It's something that people can fall ill to all year round, right?
Absolutely, and that's very important to note that we don't just vaccinate for this during flu season. It's a year round.
Okay, and how many, I guess, if your doctor doesn't bring it up, how do you go about bringing this up with your doctor so that they can get a prescription for it?
And actually, we can do a lot of these vaccinations under protocol at the pharmacy. So if you were to come in, we would do appropriate screening to see if you're eligible for the vaccine, if it's something that you should get, and then we can administer the vaccine in the pharmacy.
That's what I really like about Bremo Pharmacy, because every time I talk to you all, it's always about building a partnership with the patients, so they're not on their own, and it's not just like they come in with a paper from the doctor. They actually have knowledgeable help and experts there.
Yes.
Well, thank you so much,
Thank
Tana.
you.
And if you want to find out more information about the Tdap vaccine, pertussis, or whooping cough, just visit bremorx.com.